So I just will add my thanks to all the great organizers who pulled this together. It's really a joy of mine to get out of DC and get down here. But I do want to add one more thing, which is that all of you are who make this possible. So I'm going to ask you all to give yourselves a big round of applause for coming out today on Saturday, for being the movement that understands that healthcare as a right is the goal that we're fighting for, and that we only lose when we forget what we're fighting for. We can have setbacks, but we only lose when we forget why we're fighting. So let me tell you a little bit about who I am and what we've done at Social Security Works and how it relates to the fight for healthcare as a right, improved Medicare for everybody. So do you all remember in 2010, can you go back to that time? Do you remember the turn to austerity that happened? Remember that? The premature turn to austerity, but it's premature because it should never happen. It makes no sense. But it made even less sense in 2010. Remember President Obama impaneled the Bowles-Simpson Commission? Do you remember that? The BS Commission? With their BS report? Their BS report that said, we're going to, they don't want to do it, but everybody knows that we have to cut Social Security benefits. Everybody knows that we have to destroy Medicaid. It pained them, but just everybody knew. You remember that? That's how they like to do it, right? If you turn on the TV, you'll see person after person saying, look, I love Social Security, or I love Medicare, or I love Medicaid. I'm just worried that it's not going to be there for those people who need it in the future. And they kind of leave off the next part of the phrase, which is why I want to cut it and make sure that it's not there for those people in the future. That's how the elite narrative works. So Chomsky said that what the elites do to control people is they define the boundaries of the debate, and then they encourage rigorous debate within those boundaries. Y'all have seen that, right? What if you get two talking heads on who just argue all the time within a preconceived notion of what is possible? And we're all told that we are completely ridiculous for saying that as the only advanced economy that does not provide healthcare as a right, that it is possible to do so. But that's not allowed. That's outside of those boundaries because the corporate media is in the business of advancing their bottom line. Not the news. They're not here to deliver the news. They're here to sell you widgets. They got to keep you watching through the commercials that sell you widgets. And importantly, they have to tell the news in a way so that the people don't understand that their corporate owners are extracting wealth from our pockets. That their corporate owners and the interlocking boards that they're on are the exact same people who keep the prices of pharmaceutical drugs in this country sky high. I'm going to go a little bit back and forth here, but I can see y'all are dedicated. You know that this is all one fight. The Wall Street-led greedy liars over here, they permeate through the entire structure. So the pharmaceutical industries are just fronts for Wall Street. Wall Street sees that they can extract money from us through a non-healthcare system by keeping the price of drugs sky high, by keeping the healthcare system fractured and not working. So let me do one of my favorite things, which is bag on the pharmaceutical industry, and then I'm going to tell you about how we fight back. Does that sound good? Yes. So how many of you know who pays for the research and development of pharmaceutical drugs?
We do.
Who is it? Wait, I thought it was Pfizer. Don't they put all of the money into... No? I thought they were the... No? Y'all are too smart for this rhetorical game. It's obviously us. It's the taxpayers through the NIH, through university grants that we give. We the people give. Y'all know about Zika, right? Yeah. Do you know that DOD, our tax dollars, developed a vaccine for Zika? Yeah. Did you know that? Yeah. Now, what do you think they're going to do with this vaccine? Here, I'll tell you what they're going to do. They're going to give the vaccine to a billion-dollar pharmaceutical company called Sanofi, a French company, along with $143 million of our money to this company that is part of an industry that's the most profitable industry in the world. They give them the patent and $143 million of our dollars to cover their risk. What risk? We already developed the patent. And when they give that to Sanofi, do you know what Sanofi turns around and does? Charges us the highest prices in the world. We pay 3 times to develop the drugs, to grant and protect the patents, and then we pay the highest prices in the world. So the question is there another way? Right? This is that idea that's outside the bounds of acceptable debate. Of course there's another way. We paid for it. We developed the patent. So we should hold the patent. The patent should be held in public. Do y'all know who Jonas Salk is? Exactly. So when he developed the vaccine with a lot of help from the public, but this man dedicated his vaccine to the public health. I think we need a movement to sulkize all of the pharmaceutical patents. All the pharmaceutical patents that we paid for should be ours, and the companies can make money. They're going to have to compete over production and distribution and all of that, but they're not going to be the most profitable industry in the world, because right now what they do is they own Washington, D.C. to protect their monopoly profits. So, how do we get there? In 2010, everybody knew that Social Security benefits were going to be cut. Luckily, I don't get any of those memos. I don't get invited to the Christmas parties in Washington, D.C., at the White House, or any of the other ways that they keep people in line. So when everybody knew, I was like, no, they're not. And you know who else didn't get the memo? The American people. The American people, not a single one of them was clamoring for Social Security benefits to be cut. In 2010, we were clamoring that some Wall Street criminals would go to prison. And they're in DC, they're like, what did you say? Steal your money by cutting your benefits? Okay. But what we did at Social Security Works is we took it upon ourselves to tell the story of Social Security. We play a translational role. We let people know what the folks in DC are doing, what the BS Commission had on their agenda, stealing our benefits, and then we translate back into DC the rage and outrage from the people around the country about those plans. And in doing so, we had some champions who stood up with us, because DC is not filled to the brim with terrible people. There's a ton of terrible people there, but there's some awesome people too. John Conyers stood up with us when no one else was with us. No one was with us yet. And John Conyers said, I'll stand with you. Let's get some live streams in that BS Commission so the American people can see what's going on. And of course, the BS Commission was like, no, 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 it's so good for the people. We don't want them to see our negotiations. Trust us, it's good for you. You've seen that before, right? I love that argument. The TPP is so good for you that you can't even know what's in it. And they obviously didn't let us get our cameras in there, but we stood and we brought in more champions. And Keith Ellison, Raul Grijalva, Bernie Sanders, they stood with us. Yeah. And for a long time, that was actually some of the few people who would stand with us. And then, over time, as we kept telling the story over and over and over again, and even though the elite media wouldn't tell the story, you all tell the story. We tell the story through our social media. We tell the story through different shows, the Thom Hartmann program, other progressive media. And slowly but surely, our pool started to grow. So 2010 to now, it's a long time. I'm not going to go through all of it. But we fought lots of these. The BS Commission was just the first one. These were all fast-track commissions to cut our benefits. The fiscal cliff, right, you remember all these, it was one after another after another. Self-induced emergencies. And we beat back every single one of them. Obviously, the opportunity cost of that fight was enormous. And we got sequestration, which is terrible. Imagine if we'd spent all of those years fighting for a green economy so that we could give a climate to our children and our grandchildren. So that these fights were such a distraction, but we did win. We won time and again. 7 fast-track attempts behind closed doors to steal our benefits, and we beat each and every one of them. So from 2010, when everybody knew that our benefits were going to be cut, to now, we have 85% of the Democrats in the Senate on bills to expand Social Security. We have 85% of the Democrats in the House on bills to expand Social Security. Because we didn't just fight against cuts. Remember at the beginning I said we only lose when we forget what we're fighting for. We're not satisfied to fight on their turf. We're not satisfied to just beat the greedy liars who are trying to steal our money. We're coming for their money. And they know this strategy. That's why they're always on offense. And that's why we have to always be on offense. That's why we have to fight always to expand and improve Medicare for everybody. We have to fight for health care as a right in this country. That doesn't mean we're not going to fight against Trump care. We are. And how many of you all have noted that it's single-payer activists or improved Medicare for all activists who are at the front of the fight against Trump care? I'm kind of like wondering if I should bring up Obamacare a little bit. I should. Obamacare is not what we want for this country. We want improved Medicare for everybody. We were told, and I fought for Obamacare, I fought for the public option, and we got good things in it. Community health centers, Bernie Sanders got over $1 billion. There's good things in there. That's why we're fighting against Trump care. But we were told, and the people were told, that we should only go for Obamacare. Because if we go for single payer, if the Democrats go for single payer, this is what we were told. We're going to face 8 years of attacks on single payer. They're going to run every single election against single payer. And the moment they take power, they're going to get rid of single payer. If we give them their ideas, premium support, they won't fight against it. They were so earnest in telling us this. And yes, we did get good things in Obamacare, but it's so obvious that no matter what we fight for, the nihilistic, Wall Street-driven crowd are going to fight to destroy it. So now we are actually fighting to preserve Obamacare, which is primarily Romney Care, an idea that came out of the Heritage Institution, right? Because the Republicans don't care about ideas. They don't care about anything. They just want to destroy systems for profit. That's why they hate Social Security, because it works. Less than 1 penny of every dollar that goes in funds the entire administration of the program. That's why they hate Medicare, 2% administrative costs, because it works. That's why they hate Medicaid, because it works. That's why they hate public education, because it works. They are driven to destroy because chaos and destruction is very profitable. So what we have to do is never forget what we're fighting for. Never forget what we're fighting for. Healthcare as a right. If literally every other advanced economy in the world can do it, what are we supposed to be? The magical unicorn that just can't figure it out? I don't buy it. And I hope you all don't buy it. You don't buy it, right? No. And now's our time. And we're going to win this one as long as we never forget what we're fighting for. Thank you so much. My name's Alex Lawson. Social Security works.